Hey everyone, let's jump right into this clinical explainer on a super common but honestly incredibly deceptive pediatric emergency: vitamin gummy overdoses. We see this all the time, right? But telling the difference between a harmless sugar rush and a life-threatening toxidrome, well, it's easy to miss if we aren't paying close attention.
Here's what we're covering today: the candy trap, high-risk toxins, clinical timelines, pre-hospital triage, ED protocols, and prevention strategies. Section 1. The candy trap. So why do these ingestions happen so often? Well, modern vitamin gummies are basically engineered to look and taste exactly like candy. They're bright, sweet, and have zero medicinal taste. It's complete psychological trap for a young child. They just think they hit the jackpot. Because of this, it's super common for a kid to just down an entire freshly opened bottle in one sitting, instantly exposing themselves to toxic, life-threatening amounts of micronutrients.
Moving on to Section 2, high-risk toxins.
We really need to bust the myth that all over-the-counter gummies are harmless. There's a very clear clinical distinction here. Water-soluble stuff like vitamin C and most B vitamins, they're generally low risk and might just cause some mild GI upset. But if that gummy contains iron, vitamin A, vitamin D, iodine, or zinc, you're looking at a high-risk scenario requiring immediate aggressive medical attention.
And here is the kicker. Out of all those standard ingredients, iron is absolutely the most dangerous, severe threat we face in these overdoses. If a kid gets into an iron-containing multi, be on high alert for early, severe symptoms. We're talking repeated or bloody vomiting, intense abdominal pain, explosive diarrhea, and significant lethargy or drowsiness. These are your massive red flags for acute iron toxicity. But iron isn't the only bad actor here. We've got to watch for other specific toxidromes too. Vitamin A overdose can cause severe headaches, dizziness, and critically increased intracranial pressure in very young kids. Too much vitamin D triggers severe hypercalcemia, think excessive thirst, frequent urination, and muscle weakness. And don't sleep on iodine. Severe poisoning can literally cause a burning sensation in the mouth or throat, followed by major breathing and circulatory issues. Section 3. Clinical timelines and delayed symptoms. This timeline is absolutely vital for your clinical decision-making. Symptoms from zinc and iodine usually kick in within just a few short hours. Iron, though, it has a notorious latent phase. A kid might have initial GI distress, look like they're getting better, but then bam, massive metabolic, liver, and heart complications hit 12 to 48 hours later. And vitamin D is a slow burn. Severe hypercalcemia symptoms might actually be delayed for several days post-ingestion. I really want to highlight this direct warning from our source data. Burn this into your brain. An initially well-appearing child in your waiting room is not a free pass. Do not let it give you a false sense of security, especially if iron or vitamin D are anywhere on that ingredients label. All right, Section 4, pre-hospital triage advice. When you or your triage nurses get that panicked phone call, instructions have to be crystal clear. Do tell parents to keep the kid calm, try to estimate exactly how many gummies are missing, and absolutely bring the physical bottle to the hospital. But do not, under any circumstances, let them induce vomiting or give home remedies like milk. And never, ever advise a parent to just wait and see if symptoms develop with these high-risk ingredients.
Section 5. Emergency Department Management.
Okay, so the patient is in your ED. We need a rapid, highly structured workup. Step 1, physically assess the kid and use that bottle to calculate the maximum possible dose. Step 2, stabilize vitals and check their overall hemodynamic status. Step 3, draw targeted labs right away. We need serum iron, calcium, and baseline metabolic panels. Step 4, establish IV access and start supportive fluids if they need it. Now, if your labs and clinical picture confirm severe iron poisoning, you have to act fast. Specific antidotes, namely deferoxamine, must be initiated rapidly. From there, that child requires highly monitored observation or direct admission to the pediatric ICU. Finally, Section 6, clinical prevention strategies. We have got to be proactive at discharge and during well-child visits. Counsel parents to store these supplements completely out of reach and sight in their original, child-resistant packaging. And we have to tackle the behavioral side. Explicitly tell them to never call vitamin gummies candy or treats, and don't let kids serve themselves from the bottle. We have to break that psychological association. So I want to leave you with this thought for your next shift. Are we doing enough to warn parents about the 48-hour deceptive calm of iron toxicity during routine checkups?
Do your families know that an overdose of seemingly healthy vitamins can literally be a ticking clock? It's our job to make sure they do. Thanks for tuning into this explainer, and stay sharp out there.